Kia ora. Welcome to the Salmonella webinar, proudly brought to you by MSD Animal Health. I'm Pauline Calvert, a Livestock Business Unit Lead here in New Zealand. And over the next sort of hour or so, we're going to give you some information around Salmonella and what we're seeing occurring in New Zealand. Talking about trends of diseases, looking at some of the risk factors that's associated with Salmonella on New Zealand farms, and also just having a discussion with a number of experts I have with me here today that are going to share their information about Salmonella. Before we kick off with our presentations, I really want to thank some of our key stakeholders that have really been behind getting this webinar up and running. And of course the webinar is on the back of a series of really successful roadshows that we've been holding throughout New Zealand, talking to our prescribing veterinarians about Salmonella in New Zealand. So those stakeholders, first and foremost, a big thank you to MPI, because some of the data we're sharing with you today is coming directly from the surveillance team, and they do a fantastic job in getting this information together, putting it together in a manner that not only we can understand, make sense, but also communicating with us the importance of getting this information out. And also in the room I've got a few representatives from those stakeholders, and first of all Dairy NZ and Beef and Lamb, and we do have Will here from Beef and Lamb, and I will introduce him soon. Dairy NZ and Beef and Lamb are here because they understand the importance of this information, as it really does need to get to the farmer, their stakeholders, so they can make informed decisions on farm are the best ways to manage and mitigate risk around Salmonella. I've also got Lisa here from Gribbles, and Gribbles, of course, are an important partner with our veterinarians and also with MPI, collecting that information about what they're seeing from cases being reported in. So big shout out to the work that they do in New Zealand. And of course we have NZVA not with us today, but of course they've been part of the roadshow and strong supporters of that. And of course MSD, we are the sole manufacturer of a Salmonella vaccine in New Zealand, so I think it's really important that we front foot this and get out and have these discussions. So on that note, I'd like to actually introduce our speakers today, and I'll start over to my far right. Will, do you want to introduce yourself?
Yeah, hi there everybody. My name's Will Halliday. I'm a veterinarian. I work for Beef and Lamb New Zealand, and my job title is Senior Advisor for Biosecurity and Animal Welfare.
Thanks, Will. Lisa?
Hi, I'm Lisa Humoya. I work for Gribbles Veterinary Laboratories, and I've got a particular interest in Salmonella, so it's really great to be here today, sharing some of my information and joining in the discussion.
Amanda?
Hi, I'm Amanda. I'm a technical veterinarian for MSD Animal Health, and my region is the Lower North Island, which has been a bit of a hot spot for Salmonella. So I spend a lot of time talking to vets and farmers about the disease in outbreaks, and also trying to prevent outbreaks from happening.
Thank you. Thanks guys. Each one of our guests today are going to give us a little bit of a rundown on their area of interest in Salmonella, but we really want to focus on the disease itself. We want to be able to highlight some of the risk factors, as well as some of the regional differences of Salmonella in dairy cattle and some emerging trends that we're seeing here. So I think probably a good place to start, Amanda. Do you want to give us a bit of a rundown on Salmonella as a disease in itself and kick us off?
Yeah, sure. So just making sure everybody's on the same page with their understanding of the basics of the disease, the different serotypes that we see in New Zealand livestock, and how the changing prevalences over the last few years are being tracked. So firstly, what is Salmonella? Most of you watching this webinar probably know it's a bacterial disease. Lots of species can be affected. It's what's classified as a gram-negative bacteria, and that means that it has a toxin in its cell wall that can make animals and people really sick. In the picture on the bottom right of the slide, you can see like a rod-shaped bacteria with lots of little tails called flagella that help it move. And there are some proteins on the body of the bacteria itself, and then also on the flagella, that determine which serotype the bacteria fits into. And different serotypes require their own special immune response for the animal to fight the disease. So far, about 3,000 serotypes of Salmonella have been identified, but the ones that we care about in New Zealand livestock can fit into sort of four main serotypes, and they're all serotypes of the same species and subspecies. So that's Salmonella enterica, subspecies enterica. Typhimurium is, for a long time, was the most common serotype in livestock. It's still one of the most common serotypes in humans, and it tends to cause enteritis, which means gut inflammation and scouring, primarily. It can also cause blood poisoning or septicemia and death, but it's most commonly associated with scouring. Bovis morbificans is a serotype that we're going to talk a lot about tonight or during this webinar. It can cause enteritis as well and septicemia, and it's of particular importance because it's emerging. So we've seen a big increase in case reports of Bovis morbificans, particularly in dairy cattle in the last several years. Brandenburg, a lot of you may have heard of Brandenburg or have dealt with it directly. It tends to cause abortions in late pregnancy in cattle and sheep, and that, as of the recording of this webinar, serotype is just confined to the South Island. At this point, basically the entire South Island does have case reports of Brandenburg. And Hindmarsh, which is predominantly a sheep serotype and tends to cause enteritis in sheep, and a big hotspot for Hindmarsh, at least historically, was the Hawke's Bay type region of the North Island. A new serotype that we're just starting to see, it's brand new since 2019, is Salmonella Give. We don't really know anything about it, so we're MPI is monitoring it pretty closely, and if you do have outbreaks or cases of Give, it would be great to get more information about that. So talking to your local pathologist at your diagnostic laboratory, or talking with the MPI surveillance team, or letting MSD know so we can try and get some more information about Give would be great. All of these serotypes of Salmonella can be transferred to people, so people can become sick with these diseases, and they're all notifiable to milk processors or meat processors. So it's important, if you're having cases on a client farm or on your own farm, that you let your customer, your milk company or your meat company know that that's happening. Usually that'll mean that they'll put you last on pickup for milk, just to try and minimize risk to their own staff, and it would mean that they can help you try and put some mitigation strategies in place. So how does the disease actually work? We can kind of break Salmonella in livestock down into enteric disease and Brandenburg abortions in terms of how they present clinically, how the animals look. Some rough guides to how many animals get sick and die, we'll just go through now. So enteric Salmonella in cattle tends to spread by cattle accidentally eating feces from other cattle that have been shedding the bacteria into the environment. So that'll be on the paddock. It can survive for months on the paddock, although it has also been shown to pass from the cow to her fetus. Occasionally vertical transmission that way has been shown, and you can actually give a cow or sheep Salmonella if you put some into their eye or if they inhale it. So if you give them a high enough dose in any way, they can get sick. And if the animal's healthy, it takes a lot of Salmonella to make them sick, millions and millions. But if they are off feed, if they're stressed, if there's been a recent diet change, then many, many fewer Salmonella bacteria are required to make the animal sick. So it might just be hundreds or thousands of bacteria rather than millions and millions. As I mentioned a moment ago, the Salmonella can survive for months in the right type of environment. So in dry dust of sheep yards, it's been known to survive for months. In very wet weather, in kind of the perfect environmental conditions, it can survive for months. And those case peaks tend to happen, and bad years for calf scours caused by Salmonella tend to happen in wetter seasons. For an enteric outbreak, the average that's been reported in the New Zealand literature is about 10% of a dairy herd, becoming sick, and mortality rates can vary. Probably around 2% would be a reasonable average in a dairy herd. But that can depend quite a bit on what other factors are going on. So what's actually caused the outbreak, which we'll talk more about later, and what sort of condition are those animals in. So that's all enteric Salmonella, so the kind that affects the gut. Brandenburg causes quite a different syndrome, and it causes late-term abortions primarily, but it also kills animals and it can cause scouring. It's also spread by animals accidentally eating the bacteria, either if there have been aborted materials left in the paddock or if it's being shed in feces or reproductive secretions. The infective dose hasn't really been very well described in the literature, and sometimes what's been demonstrated to cause disease in some situations isn't enough to cause disease in other situations, so it's not really clear how much an animal needs to eat to get sick. Similar to the enteric serotypes, it can survive for months in the environment, and in a herd that has never had Brandenburg before, or a flock that's never had Brandenburg before, it can be quite spectacular. So you get a lot of sick animals, particularly first calving heifers or two-tooth ewes tend to be quite significantly affected, with lots of them getting sick. So the average in a survey that we did a couple of years ago for MSD showed about 13% of first calf heifers would become sick on average, and 2% of mixed-age cows if the herd had mixed-age cows affected. Most of those Brandenburg outbreaks go on in late gestation, so right in the early spring period or late winter period, and they last about a month, quite explosive. And mortality can vary quite a bit again, depending on what else is going on the farm, what's precipitated the outbreak. Heifers have been shown to have mortality rates up to 9%, so it can be very significant impact on that farm. But again, it depends on sort of what the herd history is and how the outbreak's managed and contained. Okay, so this is what's been going on in New Zealand, and this is really what's behind the whole series of roadshows that we've been doing and the webinar in and of itself. This is why we're bringing all of this to you. Before 2013, almost all cases of Salmonella in cattle were caused by Typhimurium, and that's a serotype that's been around for a really long time. It used to cause sometimes outbreaks, but often it would kind of cause a case here or there and nothing super worrying. But over the last since 2010-11, the epidemiology of Salmonella has kind of been changing. So there have been a lot more explosive outbreaks occurring at odd times of year, not necessarily the traditional calving time when cattle are really stressed. They've been occurring throughout the year. And then since 2014-15, we've also been seeing an emergence of Bovis morbificans spreading throughout the country, which Lisa's going to talk more about. So we're kind of thinking of Salmonella in general, the trend is going up, and then the serotype distribution is also changing. It's acting like an emerging disease, which is a bit of a worry because there's so many unknowns about Salmonella in New Zealand. We don't have a lot of research to go by, so we need to be looking at it, keeping an eye on it, particularly the newer serotypes, Bovis morbificans and GIV.
Amanda, on that slide you've just showed us, you're talking about 600 cases. What does that mean? Is that an individual animal, or is that a...
Yeah, great point. So these are MPI-confirmed Salmonella cases in cattle. For every farm that has a case or an outbreak, they can submit one sample or one isolate from that case to ESR for serotyping. So that case could represent a single case on a farm, or it could represent an outbreak where half the herd's affected. So we don't actually know by looking at this data set how many sick animals are behind that, but we can say there are 600 different cases or outbreaks that have been reported to MPI. And you can see that that's a significant increase over the 100 or 120 that we were seeing per year pretty steadily prior to 2014.
So if we put that in context, Amanda, over 600 cases, if we make that assumption that that's one farm, in terms of prevalence on New Zealand farms, how many cases are we actually really seeing on dairy farms?
Yeah, so if you assume that those are all coming off of farms that have milking dairy cows, which they won't be, but it's an assumption for numbers' sake, we have about 11,000 dairy farms in New Zealand. So if 600 dairy farms are affected, that's about 5%. So just putting it in an order of magnitude that's easy to understand, about 5% of dairy farms are being affected a year. But don't get too attached to that number, because probably a lot of those cases might be coming from calf rearing operations that don't have milking herds. So the denominator, if you like, is probably a bit bigger than that. But it puts it in context a bit to think about 5%.
Yeah. So I've got a question as well. I just wonder, for those farmers who perhaps haven't seen it before, what sort of symptoms are they looking at?
Yeah.
You know, what's going to sort of flip that switch that, oh, this could be Salmonella?
Yeah. Often, so it depends on which serotype you're seeing and what the background immunity of the herd is and what stress event has started the outbreak. You might see dead animals as your first sign. You might see abortions as your first sign, or most commonly you'll see scouring with some blood and very off-color cows as your first sign. So it does, and Lisa, you might weigh in on this as well, what you see from the lab perspective, but it kind of does depend a bit. Is there anything you'd like to add on that?
Yeah, no, I think, you know, the large majority of our cases are scouring cases, or if you're talking about calves, sudden death. But with Brandenburg, obviously, we're also seeing abortion, but yeah.
Hey, Will, we've heard a lot about Salmonella in dairy cows. Perhaps it's a good opportunity to talk to our listeners around what's it like in sheep?
Sure, okay, so it's important to remember there are two different types really, or two different disease syndromes that we see in sheep. So one of them being the enteric type that is normally associated with hindmarsh, and that's up and down the country. And really, it's pretty simple. You're going to find multiple dead sheep. They will generally have a really nasty green scour, very smelly green scour. It's important, don't touch them. Or if you do, wash your hands afterwards. The other type that we see is the Brandenburg type, which is, it really manifests as an abortion storm. So you'll see a lot of ewes aborting all at the same time. Once again, don't touch it, go and call your vet.
So I guess if you're a farmer watching and you notice particularly at high-risk times of year when the animals are quite stressed, so around calving or late gestation, or even between calving and mating, anytime there's a big diet change, if you're seeing scouring, deaths, it is worth getting on top of and probably getting your vet involved sooner rather than later, and not saying, oh, you know, livestock, dead stock, let's wait and see what happens. Get onto it, because once that outbreak starts to snowball, it's harder to stop. So the longer you wait, the harder it is to get ahead of.
Probably worth reiterating as well, you mentioned that it can be passed into humans.
Yes.
So, yeah, good hygiene, washing your hands, etc. after handling those animals. Yeah.
Absolutely, absolutely. So if you're calving cows, you know, trying to wear shoulder-length gloves, making sure you're washing your hands, trying not to let your kids get in with sick calves. Yeah, that's, if you have sick animals, trying to isolate them and put some biosecurity around them, so foot baths, things like that. Yeah, assume you can get sick. If an animal's sick, assume it could make you sick, and that's probably the safest assumption. Yeah. Cool. Okay. So the next slide is just looking at the regional prevalence of each of these 4 serotypes that are the most common in cattle. For Brandenburg, Bovis morbificans, and Typhimurium, the heat maps on this slide are from 2019 data. For Salmonella Give, it was just appearing in 2019. So this is 2020 data in the map for Salmonella Give. So we'll start on the left. As I mentioned, Brandenburg at this point is still confined to the South Island. 2019 was actually a relatively light year for Brandenburg, so it sort of peaked. The brightest red year for Salmonella Brandenburg was, I think, 2017. And it's backed off a little bit, probably as the South Island cows have gotten a little bit of immunity and or been vaccinated on the herds that are affected. Bovis morbificans is still rip-roaring around the place. So it started on the North Island and is now represented basically everywhere. And Lisa's going to talk about Bovis morbificans in more detail. Typhimurium's everywhere, and it's been everywhere forever, basically. So there are surveys from the 60s in which Typhimurium was around and pretty common in dairy cattle. Give is, at this point, focused in the Waikato, and Lisa, you were saying the South Waikato.
In particular, yeah.
Yeah. So the odd case from the Bay of Plenty, but pretty much the Waikato as of 2020 is sort of ground zero for GIV. Okay.
Great, thanks Amanda. Well, it's quite a lot to take in. Really, really interesting. I think probably great time to hand over to you, Lisa, and give us a bit of a lab perspective on what you're seeing and what we can learn from it. Thanks.
Cool. So I'm going to carry on where Amanda left off. I guess I'd reiterate the point with the MPI surveillance data. One of the limitations of that is it doesn't give you a lot of detail about what sort of cases are involved within the increase in Salmonella. So, we're seeing this rise in Salmonella. Are these all calf scour cases? Are they herd outbreaks? Or are they individual scouring animals? And as Amanda pointed out, each case that's reported to MPI can represent quite different things. It could be an individual scouring cow, it could be a group of scouring calves, or it could be a full-blown outbreak with multiple sick adult dairy cows, dead animals. So one of the benefits of working in a laboratory is that we can squeeze a little bit more information out of cases that are coming through, either by looking at the submission forms or if we need to, calling up vets and getting additional information about the cases that they're sending them. So I thought it'd be interesting to present a couple of graphs that have split up the trends that we're seeing into adult cattle versus calf cases. One thing that I'll point out, the large majority of the cases that we're seeing are in either adult dairy cattle or in calves that are of dairy origin. So the first graph that I've got is of adult dairy cattle, and what I've done for these graphs is I've separated out Bovis morbificans from all of the other isolates. So the top maroon line is for all isolates other than Bovis morbificans, and then you can see in the orange line there is Bovis morbificans, and you can see nicely how since 2015 it's just taken off exponentially. I've separated the two out because I think in my mind we've got sort of two components to where we're sitting at the moment with Salmonella. We've got an underlying moderate increasing trend, related to risk factors that are present in our dairy herds. But in addition to that, we've got unusual pathogenic strains of Salmonella emerging. So I think it's sort of important that we look at both and understand why both of these are contributing to our increasing Salmonella numbers. The blue line at the bottom is Brandenburg abortions, and you can see with them that we've also been seeing a steady increase over the last 10 years in those cases. As far as calves are concerned, a kind of similar picture really. Since 2015, exponential increase in Bovis morbificans cases, and a steady increase in other serotypes. We've been seeing quite dramatic changes in our calf scour panels that come through our lab. So back in 2014, about 10% of our panels were positive for Salmonella in the North Island, whereas 2018, which is the latest data that I've summarised, I think we were up to 25% of our calf scour panel submissions were positive for Salmonella. And as well as the increase in Salmonella isolations, there's been quite a dramatic shift in the serotypes that we're seeing. So back in 2014, it was typhimurium, which has been the traditional cause of calf scours. In the South Island, a little bit different. 2014 was a mixture of both Brandenburg calf scours and typhimurium. When we jump forward to 2018, Bovis morbificans in the North Island accounted for 70% of our Salmonella isolates from calf scours, with only 30% being typhimurium. And the South Island has been more latterly affected by bovis morbificans. So 2018 was still very much Brandenburg and Typhimurium, but bovis morbificans was starting to sneak in and starting to increase in the percentage that we were isolating from the South Island.
Can I ask a question, Lisa?
Yeah.
Do you have a sense of how many samples have multiple serotypes cultured?
No, you wouldn't, because as you pointed out, we only submit one isolate from each outbreak. I guess from a subjective perspective, when I see repeat cultures come in from a farm, they're usually the same serotype both times. So, you can't rule out that there's not dual infections going on there, and I certainly have some calf rearing places where there are two serotypes that are commonly turning up. So obviously they've got both of those serotypes, and in a calf rearing situation, obviously there's lots of opportunity for new Salmonella serotypes to be coming in each season. So, realistically, it's probably, quite a mixture every year. It's hard to know. You certainly couldn't discount there being dual infections, but I think generally if you're seeing an outbreak, it's going to be one serotype that's going to be causing that, just from a sort of first principles basis more than having any hard evidence for that. So, yes, but you know what assumptions are like, so yeah. So just this last graph, I just wanted to look at bovis morbificans by itself and put the adult cows alongside the calves. This is something that I noted a couple of weeks ago when I was looking at the data, and quite interesting looking at the earlier years when bovis morbificans was emerging. Through our lab in 2013, we only had 2 submissions that were positive for this serotype, and they were both herd outbreaks in the Taranaki. 2014, we didn't have any cases, and then 2015, we saw this first sudden jump in case numbers. And what was interesting about this was not only that the numbers suddenly made a jump, but these isolates came from all across the North Island, from South Auckland, Waikato, Taranaki, Waikato, Manawatu, Wairarapa, Central Hawke's Bay, Ruapehu. So going from small numbers to suddenly cases across the North Island. And when I went back and had a look at these submission numbers, what was interesting for me was that in 2015, apart from one herd outbreak in Taranaki, all of the rest were calf scour outbreaks, and they occurred across a really wide region. It's hard to know whether our data is representative of what's happening in the other laboratories, but for me it raises some interesting questions around whether, in the case of bovis morbificans, whether there's been any role with the movement of young calves in the dissemination of this disease. So.
Yeah, I was just going to ask that actually, Lisa. Was, we often say that animal diseases move with animals.
Yeah.
Would you consider that to be the major case here?
It's hard to know because, as I said, is what we're seeing representative. We're only one of the laboratory groups that are operating in New Zealand, but certainly, it's not a novel thing to come up with when you look at the early literature from the 1960s and 70s in New Zealand. At that time, they were raising questions around the movement of very young calves, maybe a risk factor for disseminating, novel pathogenic strains of Salmonella, and certainly overseas, the movement of calves, plays a role in that. So. I think it's more something that I've picked up, and whether we can look into that more, and it would be nice to understand a bit more about how these new emergent strains are moving. Whether there's going to be something that we can do about that is another matter, but being able to understand things always helps with getting on top of an issue.
So on farm that might look like quarantine, for example, of incoming livestock, etc.
Yeah,
cool.
definitely. Yep.
Thanks.
So I just wanted to present a little bit of data more specifically on Bovis morbificans, and this has been the serotype that I've been particularly interested in, and I've been doing a little bit of work to try and gather some impact data on this serotype and what it's been causing, because as we say with the MPI surveillance data, we don't really know what that represents and what sort of effect that's been having on farm. So I've been looking at gathering follow-up information from all of the Bovis morbificans cases that we've been receiving through the lab, and I've been concentrating on the period between June 2019 and June 2020. And basically what I've been doing for all the cases that we've received, been contacting vets and just trying to get some follow-up information on the numbers affected, the numbers dead. So between that period we had 197 submissions that were positive for Bovis morbificans, and they came from 161 incidents or individual farms. Some of the outbreaks we had multiple submissions, which is why we had more submissions than we had actual farm cases. So to give you a bit of an idea of what that 161 cases represented, about 55% of them were from calves or pre-production dairy cattle. The vast majority of those were young calf scours rather than sort of yearlings or slightly older animals. And 45% were from adult dairy cattle. And I've given you a bit of a breakdown of the age of the calf group. About 50% are from 4-week-old or less, which is kind of the typical period where we'd expect to see salmonella scouring in calves. But we did have a few cases in the older animals, and also quite a block there of cases where we didn't have any information on the submission form as to age. So yeah. So far I've managed to get follow-up history on 40 of the cases, and they included 13 cases from calves and 27 from adult dairy cattle. And I've given you a bit of a breakdown of the calves, quite a varied group size from 3 pet calves through to larger groups in calf rearing situations. And you can see from this that the morbidity is actually pretty high. We're up nearly 60% morbidity, so about 60% of that group were affected with scours. But again, a range of results. You know, in some of the worst cases, we had 100% of the calves being affected. The worst was a group of 150 calves. All of them were affected, and all of them ended up being euthanized and dying. So quite a significant event on that particular farm. Mortality also was high, nearly 30% mortality. Again, quite a range. But I certainly have had a number of cases where it could involve quite large numbers of calves and you know, obviously be quite a significant event for that farm.
Lisa, or maybe even Amanda on this one, you know, we've obviously had a roadshow and there's been a lot of interest around that, like especially that high morbidity rate in calves. What's your feeling? I mean, what's the long-term outlook for these calves? Like, firstly, how long are they sick for? And also, what's the recovery? What are we expecting, the impact?
Yeah, it's kind of difficult to know, really. I guess it's another hole in our information around what's happening currently. You know, I've certainly talked to some vets where, you know, the animals have recovered well and they've had subsequent good growth rates, and looking at them in the paddock year on, you know, you wouldn't be able to tell that they'd had those issues. But I think it probably depends very much on how they're managed, and you know, in certain situations, you know, it may not turn out so well. Obviously, if you're really aggressive with treatment and helping these animals, but yeah, I mean, certainly, you know, calf scours in general can have quite long-lasting impacts right through to you know, when they're heifers and coming into the herd. So yeah.
Yeah, there is quite a robust literature around the impact one bout of calf scours or calf pneumonia has on their subsequent lifetime performance. So yeah, prevention would obviously be better than cure.
So this is the adult dairy cows. As I said, there were 27 cases that I've got follow-up history on so far. 13 of them were sporadic involving smaller numbers of animals, and 14 were outbreaks. For the definition of outbreaks, I've used greater than 5% of the herd being affected. I've presented just in the graph here just a seasonal, the seasonal spread of the herd outbreaks only. And I've put this in here just to kind of demonstrate that we're seeing outbreaks throughout the season, so not just in the springtime. And this mirrors quite nicely what vets were noticing back in 2011 when herd outbreaks started becoming more common. They were not only seeing more herd outbreaks, but they were occurring outside of the normal calving period, springtime, when the animals are under quite high stress. So yeah, we're basically seeing cases throughout the season. And to give you a breakdown of the morbidity and mortality data from the adult dairy cows, the average herd size was around about 400, which I think mirrors quite nicely the national herd average. There was quite a range in the number that were affected, from the individual sick, scouring animal through to some herd outbreaks. The worst where there was 46% of the herd scouring and needing treatment. Mortality was generally low, so less than 2%, but again a range. And just to kind of give you some numerical value on that, in some cases up to 30, you had up to 30 dead cows, which obviously is quite a significant impact in a dairy farm. Some of the vets were really great and gave me a lot of detailed history on the outbreaks and a breakdown of some of the costs involved, and certainly had several of the outbreaks where the costs of just the drugs alone, plus or minus the vet fees, were up around 20,000 before you take into account lost milk, the cost of cows that needed culling and things like that. So quite a significant hit for an individual farm when they have an outbreak. So I'm going to touch very briefly on diagnostics, and I think generally Salmonella is relatively easy to diagnose, and I don't think vets have too many problems with diagnosing it. In young calves, if you do a culture of their faeces and isolate Salmonella, then it is giving you a diagnosis. In adult dairy cattle, I just thought it's good just to point out that you can get shedding of Salmonella in the faeces of clinically well animals. And so I think in particular, if you're dealing with a farm that has a history of Salmonella and you're coming in and looking at an individual sick cow, just to bear in mind that just because you've isolated Salmonella doesn't necessarily mean 100% that is what is causing the disease in that case, and just keep in the back of your mind that there could be other underlying issues going on, like yonis or other conditions, and it may not just be the Salmonella. But I think generally in a herd outbreak situation, if you're isolating Salmonella from the faeces of multiple animals and you've got a consistent clinical picture, that you've got a pretty good working diagnosis from there. The last thing I just wanted to touch on was antimicrobial susceptibilities or sensitivity testing. And I guess from a personal point of view, I think we should perhaps be doing antibiotic sensitivities more often on the Salmonella that we're isolating from fecal samples. The first reason for that is obviously judicious use of antibiotics. So if we're using antibiotics, I think we generally have it's good practice to be monitoring to make sure that the organisms that we're targeting, the bacteria that we're targeting, are actually sensitive and going to respond to those antibiotics, and also to be keeping an eye on that we aren't developing resistance in that bacteria through the use of those antibiotics. I guess something that's also important to keep in mind, there's certainly quite a wide body of evidence in the literature as far as Salmonella are concerned, that if you start using a particular antibiotic on Salmonella and putting pressure on them with that antibiotic, then they can start to develop resistance against that. So in the situation where we are at the moment, where we've got increasing prevalence of Salmonella, we're going to be using more antibiotics and therefore putting more pressure on this bacteria. I think it's probably good that we should be keeping an eye on making sure the drugs that we're using are going to be effective. The other thing I wanted to point out is that currently there isn't any surveillance that is going on a regular basis of Salmonella that are in New Zealand. Prior to 2016, ESR, who do all the typing of Salmonella and keep a bank of all the Salmonella isolates that we have in New Zealand, used to take a selection of the human cases that they would receive and the non-human or animal cases that they would receive, and perform sensitivities on them and produce an annual report looking at the sensitivity patterns and resistance. Since 2016, they've gone out to 3 yearly with these reports, and currently they're working on a report for the 2019 isolates, but that's not available yet. So at the moment, the only sort of broad information we have about Salmonella in New Zealand is based on isolates that were around in 2016. And obviously 5 years is a long time as far as infectious disease is concerned, and a lot of things can change over that time. So again, I think, we should be, maybe keeping a closer eye on things than what we currently are. The last thing that I wanted to point out is certainly overseas, multi-resistant strains of Salmonella are increasing and becoming more common. Here in New Zealand, we've got the situation where we are seeing unusual serotypes of Salmonella emerging, and I guess the question is, what is going to be the next emerging serotype, and will this be a multi-resistant strain? And if it is, how long will it take us to pick up that we've got this going on if we're not keeping an eye on things and monitoring it?
All the more reason to try and prevent it from getting onto your farm, I guess. Yeah.
And that's a good point actually. Well, I was just thinking about that. In human medicine with Salmonella, frequently people aren't treated with antibiotics. That's what we hear from our human doctors. So what I'm hearing and what I understand is antibiotics are reached for good reasons, I assume on animal welfare, to treat these sick animals. What do we think? Should we be using antibiotics to this extreme for Salmonella, or is there another option? Sorry to put you on the spot, people.
I'll kick off and you can, sure. Yeah. So there's some evidence particularly for Salmonella Dublin, which we don't have in New Zealand now. We have never had it in the cattle of New Zealand as far as we're aware. There is some evidence that if you treat cows with antibiotics, it doesn't necessarily make a big difference to their clinical outcome, so whether they recover or not, and it can actually cause them to become more likely to become lifelong carriers of that disease and shed it in their feces intermittently. So certainly overseas, there are a lot of vets that won't treat sick animals that have Salmonella with antibiotics, or they'll try not to, or try to minimize it, and they'll just give those animals supportive care, fluid therapy, anti-inflammatories, or they may cull them. In New Zealand, we don't have Salmonella Dublin. We definitely, anecdotally, a lot of vets feel like if they can get in quite early, as soon as they find a sick animal, they feel like the antibiotics definitely make a difference to the outcome for that animal. So it does become a bit of a animal welfare argument. in addition to the supportive care. What's your perspective on it, Lisa?
Yeah, it's a difficult one. I think the consensus of the international literature is there's good arguments on both sides, and I think it's very difficult to make black and white judgments, and I think it's very much an individual situation and what's going on. And obviously New Zealand, we're quite a unique system and different way of farming, and it's it's a difficult one.
We'll leave that to the prescribing veterinarian, shall we?
I guess, from my perspective as well, wearing two different hats, one of them being biosecurity, we want to try and prevent the disease from appearing in the first place. So it does come down to that quarantine and doing your homework in terms of what animals are coming onto your farm and what diseases they might be spreading. But obviously, every so often something will slip past the gate, and that's when I've got to put my animal welfare hat on. From what you've been telling us today, these animals get very sick very quickly, and they're quite miserable and are in severe danger of dying. So we do have to do something. And so if it's an antibiotic treatment for those animals that are going to survive, then.
I think where you can reduce the use of antibiotics, for example, in a calf scours outbreak, if you're quite vigilant about finding and isolating sick animals, that might then prevent you from having to treat the entire shed, for example. So that's an example of trying to minimize the amount of antibiotics you're using, but still balancing that with the individual animal's outcome and welfare.
Absolutely, targeted treatment.
Yeah, and let's just put it in reality. It's not like, a human doctor is dealing with 400 plus, over 450 kilo people running around or lying around in a paddock unwell. So, justified in many cases, I'm sure. So thank you, good discussion.
Yeah, so just the last thing I wanted to talk about was just to give you a bit of a picture of what we do currently know about the sensitivity patterns of Salmonella in New Zealand. And as I was saying, this information comes from the 2016-2015 isolates from ESR, and at that time they tested 138 bovine isolates, and I've given you a bit of a rundown of what they found at that stage as far as the different classes of antibiotics. I guess the good news is that resistance levels in Salmonella in New Zealand have generally been very low compared to internationally. So at that time they only found one isolate that was multi-resistant. It was a typhimurium, which was from a calf. And just very small numbers of isolates that were showing resistance, mainly to sulphur drugs and tetracycline. There were a few more that showed intermediate sensitivity, and again sort of clustered around the sulphur drugs, streptomycin, tetracycline. But generally overall, the large majority of isolates were sensitive to all antibiotics. As far as information about where we're at the moment, it's kind of difficult. I don't have any data. It's quite difficult to pull out that sort of data from our systems at the lab. From a personal, subjective basis, I certainly haven't seen any multi-resistant isolates passing across my desk. And when I do see resistance, it's usually to sulphur drugs or tetracycline. But again, very low numbers. I think it's probably just something that you need to keep an eye on within an individual practice, just to see what's happening in your area. As far as human isolates at that time, there were more multiple resistant strains in humans. About 5% of their isolates were multi-resistant, but the majority of those were linked to overseas travel. So again, harking back to what I was saying, that internationally, multi-resistant strains of Salmonella, where they're resistant to multiple antibiotics, is increasing, and certainly people through overseas travel are bringing them into New Zealand. So
where have I heard that before? Yeah. So that's my talk. I just
personally, if I'm allowed to say thank you to MSD for having me along for this session, and also I have to thank there's a very large number of vets who have very generously given their time to me, speaking on the phone, replying to my emails, and providing me with follow-up history. So a lot of this information that I've passed on about Bovis morbificans, that's come through vets being very generous with their time to me. So I'm very grateful for that.
Thank you, Lisa, and we're really grateful that you've made time. I know you're extremely busy and actually coming and sharing this information, not only in this format, but of course Lisa has been out on the roadshow actually talking to veterinarians in the field and sharing her knowledge, which has been fantastic. And I know there has been a lot of questions come through from the roadshow about the work that Lisa's doing. So it has been extremely valuable, and on behalf of MSD and perhaps the wider vet community, thank you very much, Lisa. So I think we've heard a lot about what is Salmonella. We've talked about some of the severity of this disease, I guess, in terms of mortality and morbidity. But I think now probably I might hand it back to you, Amanda, because I think there's probably a lot of people on this call today that really want to understand what are the real risk factors on farm and what can they actually be doing either in an outbreak and perhaps more importantly think about prevention.
Yeah, thanks, Pauline. So we will talk about risk factors and mitigation strategies for Salmonella, but one thing I want to emphasize is that very little is actually known in New Zealand about the unique mix of serotypes that we have here. While typhimurium is really common in other countries, and there is some literature, some evidence that we can kind of bring over from overseas, there's not much documented really about Bovis morbificans and Brandenburg and how best to manage them. So I will try and make that clear as I go through. So the agenda for this section will cover risk factors both for Salmonella shedding in dairy cattle and also for outbreaks. A brief back-of-the-envelope calculation about what an outbreak is likely to cost, particularly for enteric Salmonella, so typhimurium or Bovis morbificans, and potentially give the new serotype. And then we'll talk through mitigation strategies, so what you can do to try to prevent and minimize the impact of disease. Because MSD Animal Health, the company that Pauline and I work for, are the manufacturers of the Salmonella vaccine available for sheep and cattle in New Zealand, Salvexin Plus B. I will talk through some frequently asked questions that as a technical team we get asked regularly to try to preempt those and encourage best practice use of the vaccine so you're getting what you expect out of it when you use it. So firstly, we've talked about the changing trends in Salmonella in cattle, but where are these outbreaks coming from on a farm? And as I was saying, we don't really know. There hasn't been that much research into it, but looking at the overseas literature and some old Salmonella surveys in dairy cattle from the 60s, it's most likely that most outbreaks are probably moving around with cattle. So like Lisa and Will discussed earlier, once a serotype comes into the national dairy herd and gets set up in cows, it then is probably moving around mostly with cows. Similar for sheep, once disease like hindmarsh is established in a sheep population, it's then probably moving around with animal movements. So just like Will said, animal diseases tend to move with those animals. In Salmonella, the bacteria can establish carrier states. So in healthy-looking animals that aren't clinically sick, they can still be shedding Salmonella in their feces from time to time. And for each different type of Salmonella, that carrier state could be a different amount of time. So Dublin, which we don't have in New Zealand, can establish lifelong carrier states. For typhimurium and Brandenburg, that carrier state's probably more like about 6 months, but it can really depend on the serotype and the animal. Some surveys in New Zealand have shown from healthy animals anywhere from 0.3% to 15% of cattle could be shedding Salmonella in their feces, and those surveys were done when typhimurium was the predominant serotype. So we don't really know for Bovis morbificans and Brandenburg. And that depends a bit on seasonality, so when you look for it, as well as the amount of stress those animals are under when you go looking. Internationally, shedding of Salmonella in the feces of cattle has been reported at varying rates in different countries, and an international systematic review done in 2019 tried to look at all the different papers done throughout the world and average them. And on taking all those papers together, there's a 9% global average for healthy cattle shedding salmonella in their feces. Birds are often blamed for salmonella outbreaks, so whether it's ducks or seagulls, farmers and vets will often suspect that that's how it's gotten onto the farm. So there have been a couple of papers that have been able to find salmonella on the feet or the feces of birds, but it's unlikely that for most outbreaks that's really where it's coming from. Because if you think about the volume of feces that one bird, or the volume of bacteria that one bird can move around, it's a lot less than what a cow or a sheep would move around with them. So although it could happen, it's less likely to be the cause for most outbreaks. And again, feed. So a lot of times an outbreak will be associated with a change in feed quality, and so it makes sense to go looking for the bacteria in the feed and say that it was contaminated feed that brought that bacteria or that particular serotype onto the farm. In the literature, often that's really unrewarding to go sampling feed and culturing it. You usually don't find salmonella in the feed. If there's a feed change associated with an outbreak, it's usually because it's changed the gut environment for that group of animals and caused some sort of stress or change in pH in the gut environment that then means the salmonella that's already there circulating around can take off and cause clinical disease. So any diet change or stress basically is the underlying trigger for salmonella disease. Often it's subclinical. Of course, for these new emerging serotypes, they have to have come from somewhere originally, but it's likely that once they're established in a group of cattle, it's then moving with cattle. As I said at the beginning, in a healthy animal, it takes a lot of salmonella bacteria to make that animal sick. You have to try really hard. In a stressed or fasted animal with an upset gut, it takes many, many fewer salmonella bacteria to make that animal sick. From a North American perspective, this article kind of summarizes what I've just said. So although commodities and wild birds have been incriminated over the years, it's quite uncommon these days for a single point source event to have introduced infection onto a dairy. And this is a North American perspective, so the dynamics are a little bit different in North America, but I think the general sentiment holds true. It seems inevitable from prevalence data, so from the amount of cows that have salmonella, that infection is more likely to be introduced via carrier cattle and their feces. Many outbreaks are likely surges in clinical disease in a herd where infection already existed but may have remained subclinical. And it's the management, so reducing the immune system, the immune function of the group of animals, or increasing the disease challenge, the exposure to the bacteria, is going to cause a clinical outbreak. There are some differences from North America that we need to consider, so we don't know exactly how relevant that is to North America. For example, we don't have Salmonella Dublin. We have these emerging serotypes, which very little is known about, and we have a much higher proportion of open herds with lots of animal movements than there are in North America. A lot of herds in North America are truly closed herds with housed cattle that never go outside, and they'll rear all their own replacements and only use AI, whereas in New Zealand we have a much higher proportion of open herds with lots of animal movements and exposure to the outdoors and potential environmental contamination. So we don't really know exactly how applicable this sentiment is, but I suspect it probably holds true to some degree. To support that, there's one case that I can share with you, which is a field study that we were doing to look at how much the vaccine increases antibodies in calves if you vaccinate the dams at dry off and then feed that colostrum to the calves, how much antibody gets passed through into those calves. So we were looking at that in 2019 in Canterbury. And to do that study, we wanted to find a herd that had no salmonella in it, ideally, or no history of salmonellosis, and had never vaccinated, because we wanted to start with cows that had little or no antibody in their blood, vaccinate them, cause them to have an increase in antibody, and then that antibody from the vaccine to get through the colostrum to the calves. So we picked a herd that had never had any cases of salmonella diagnosed, they'd never vaccinated, But when we went and actually tested the cows, a lot of them were positive before vaccination for all 3 serotypes that we tested for. And I should say that the test that we used, the ELISA antibody test, was developed for this study. It hasn't been validated. It's not a commercially validated test. So we're not sure how repeatable it would be or how robust the results would be, but it was interesting to see that a lot of the animals before we ever vaccinated them were positive for all 3 serotypes. And for Brandenburg, over the study period, there was an increase in the amount of antibody in the cows that were not vaccinated. So that's that middle graph there. On the left side, the control animals increased significantly. The increase for bovis morbificans and typhimurium wasn't statistically significant, but you can see there is a bit of a numerical increase there. So what does this tell us? It tells us that, this is one farm, so it's one story, one anecdote, but it shows that on a farm that we didn't think there was salmonella floating around, there probably was. And it looks like there might have been all 3 serotypes that we went looking for, or at least a history of those serotypes, those animals being exposed to those serotypes. So, what are the risk factors that have been identified in the literature for either shedding salmonella or dairy cattle being sick with salmonella? If the herd obviously has had a recent outbreak or recent case, then you're more likely to find the bacteria if you go looking for it in healthy cattle in the same herd. That makes sense. And geographic hotspot means if you're in an area like the west coast of the South Island in 2018, where Brandenburg had just come over into that region and was starting to spread through that region, then that's a geographic hotspot. Similarly, Taranaki with bovis morbificans for several years was a geographic hotspot. So that being in that area would increase your likelihood of having an outbreak. Mixing cattle from different sources or a large herd size. So that's the idea that you would potentially buy in or bring home carrier cattle that have been exposed recently. They may or may not appear sick. Large herd size in the literature in terms of being at increased risk for salmonella is around 500 cows. So by New Zealand standards, not a huge herd, but internationally that's quite a large herd. Stress and animal movements, so that makes sense because we know how the bacteria works and establishes itself. Anything that takes animals off feed, reduces volatile fatty acid production, changes the pH of the gut, is likely to predispose animals to salmonella. And then intensive feeding. This is not been really demonstrated for Brandenburg abortions, but for the enteric forms of the disease, there have been a couple of feeding practices that have really been implicated. So pelletized magnesium oxide supplementation is the main one. Using pelletized magnesium oxide supplementation through in-shed feeding has been shown to be a significant risk factor for salmonella outbreaks. Particularly, that work was done in the Taranaki in 2000 from outbreaks that happened around 2011. And then having a vaccination program in place does reduce the likelihood of shedding. It reduces shedding and it reduces the risk of outbreaks and the severity of outbreaks. Liver fluke is an interesting one, which hasn't been shown to be a risk factor in New Zealand. Nobody's looked at it, as far as I'm aware, in New Zealand. But in sheep and cattle overseas, animals that have liver fluke are more likely to become sick with salmonella. And then this little graphic is not related directly to salmonella, but from some work that we did in 2015 to look at BVD risk factors, we surveyed a bunch of farms throughout New Zealand, cattle farms, both beef and dairy, and lots of farmers self-reported having a closed herd, but when we actually went through the checklist of behaviors and management practices, only 2% of the cattle farms that we surveyed were truly closed herds. So even though you think, you don't bring that many animals on, maybe you share yards with the neighbor, or maybe you buy bulls in, or maybe you do send your animals away to your heifers away to grazing, and that grazing block is shared with other people. So so we have a high proportion of open herds and a lot of cattle movements, and that is a big risk factor. And then just to re-emphasize that for New Zealand, one of the only papers that's been done looking at risk factors for Salmonella outbreaks in dairy cattle did implicate pelletized magnesium supplementation as a major risk factor. So you can see in this graph, every year there was a peak of Salmonella outbreaks around spring. A pelletized magnesium supplement was taken off the market, and then in the subsequent spring, that peak was much lower. So it's worth checking how you're supplementing magnesium oxide to cows. You need to do it, obviously, to prevent milk fever, but it's important to check how you're doing it, how well that product's being mixed, how well it's being blended, how well it's being fed out, and the rates as well, so how much is going in. And it may be preferable to dust rather than use a pelletized magnesium supplement. The reason that these products are used is because they don't create dust and they're preferred by feed mills for ease of mixing. But the problem is that they can pass through into the intestine without being broken down, or they might not be mixed homogeneously through a batch of feed. So some animals might get a big slug of it and some might not, and on a given day they might get more than on the next day. So the pH fluctuations in the gut are likely what's creating the problem. So a higher pH reduces the amount of bacteria that the animal needs to eat to get sick. Makes it easier to get sick. So Lisa alluded to this already, and she said that when she was talking to vets, she got the number about $20,000 for drug costs and vet time for a Salmonella outbreak. And I've just added to that the cost of the mortalities and lost milk as well. So for a typical outbreak on a 400 cow farm, if they have 2% mortality and 10% of animals getting sick or morbidity, an outbreak would be estimated to cost around $34,000 on a 400 cow farm for an enteric outbreak. And then if you think about a farm's risk profile, if they're a really low risk farm because they're low production, low input, nobody in their area has Salmonella, you've never seen it there before, they're not changing anything about their management system, maybe they are truly closed herd, maybe they don't graze any animals off, sort of a system 1 or 2. If that's a low risk farm, their annual risk of an outbreak would be very low. Maybe 1 in 50 years they might be at risk of an outbreak. Whereas if they're a high-risk farm that's doing all the opposite things, so lots of animal movements, large herd, pelletized magnesium supplementation, they would be at a much higher risk of an outbreak in any given year. So maybe they would be at risk of an outbreak 1 in 10 years, maybe even more often than that. So I've just annualized the cost of an outbreak by dividing the 34,000 by either 50 or by 10. So for a low-risk herd, the annual cost of disease is somewhere around $600 or $700. For a high-risk herd, it would be $3,000 to $4,000. And the reason that I've done that is just to give you a sense of how much money it's logical to throw at Salmonella mitigation. So in a given year, how much does it make sense to spend on trying to prevent or manage Salmonella? And it's a relatively conservative estimate because I have not assumed that any of the calves or heifers are clinically affected. I haven't accounted for an inability to supply milk. So if your milk is full of Salmonella, you may not be able to supply until the outbreak has quieted down. I haven't accounted for any zoonotic disease risk. So for Salmonella, if there are human cases linked to disease in cattle, it's most likely coming from direct contact with those cattle. So it gets pasteurized out of milk, so you don't need to worry about drinking milk from the store. It's not going to be full of Salmonella. It shouldn't make you sick. Similarly, eating beef or lamb, there's not a food safety risk. They're monitoring rates of Salmonella recovered from carcasses, and that is not on the rise. What we're really talking about here is the risk that working directly with sick cattle could potentially make you sick. This hasn't accounted for the selection of antimicrobial resistance because, as we talked about earlier, a lot of farmers and vets need to use antibiotics to help get an outbreak under control. Back of the envelope calculation, an outbreak of this size would use about 6 liters of oxytetracycline or trimethoprim sulfa to treat that 10% of cows that get sick. and it doesn't account for any impact on the subsequent mating, because a lot of outbreaks happen over calving when the cows are trying to get set up for the next mating, so it doesn't account for any impact on reproduction. And as I said, this is an enteric outbreak, so Brandenburg outbreaks are often much more costly, much more dramatic. So what can you do about Salmonella to try and reduce its impact? We've talked about how the disease works, so the most important thing you can do is try to eliminate that trigger. So whatever it is that's set up the outbreak in the first place. So if that's a diet change that hasn't been managed very well, if it's pelletized magnesium oxide supplement that you can replace with dusting, if there's something you can do to try to minimize stress, if there's something you can do to improve hygiene, so that would be things like if a cow aborts from Salmonella, removing that aborted material and burying it, isolating sick animals, making sure you're not feeding milk from scouring cows to your calves because it can pass through the milk, not just through the feces. Avoid grazing your at-risk groups of animals, so that would be your springers, your colostrums, and your young stock on effluent paddocks, if you can avoid that. And then storing and feeding supplements to minimize fecal contamination from other animals. Those are some hygiene mitigation strategies. And then lastly, as I mentioned, we manufacture Salvexin B, which is the Salmonella vaccine for sheep and cattle available in New Zealand, and that can be used preventatively or in the face of an outbreak. The whole purpose of this awareness campaign that we're doing is to try and get people thinking preventatively about Salmonella. So that's really what we're trying to encourage, preventing those outbreaks as much as you can from happening in the first place. The vaccine reduces shedding significantly, so that will reduce environmental contamination. It reduces the number of animals that get sick from Salmonella, and it reduces stock losses, so mortality and then potentially production losses caused by animals getting sick. This graph shows the case trend, which both Lisa and I talked about earlier, showing the increase from between 100 and 200 cases, both sheep and cattle Salmonella cases per year reported to MPI in 2013, up to where we're sitting now, which is over 600 cases reported to MPI per year. You can see that we haven't really talked about the sheep cases. And Will, this is probably an area of particular interest for you, being beef and lamb representative, so now might be a good time to mention that. In the reported cases to MPI, the sheep cases tend to sort of go up and down with the season, depending on feed quality, particularly in the autumn period. But Lisa, you might be able to comment on what your feeling is about how accurate the reporting of sheep cases is. What's your thought on that?
Yeah, I think sheep are a little bit difficult, more difficult to monitor trends in, because I think probably less cases end up being submitted to the lab. So, we've probably got less going, oversight on the sheep cases. So, yeah, it's kind of difficult to know with sheep. Certainly I can say we have had a very small number of bovis morbificans outbreaks in sheep flocks, and a couple of those have been quite significant mortalities associated with them. But I think because we're not capturing all of the cases that are occurring, that it's kind of very difficult to say, what the sort of trends and whether there are any changes happening within sheep. So,
Okay. Traditionally, Salvexin has been primarily used in sheep, so the majority of the doses of Salvexin plus B, and before that, before the plus B, before Brandenburg was added, just regular Salvexin, the majority of those doses have gone into sheep. You can see the red line in this graph is the vaccination dose sales trend, but there's no scale on the right-hand side for that. Because it's commercially sensitive, but you can see that the trend tracks the case trend. So we think, unfortunately we can't quite pull out which doses are going into cattle and which are going into sheep, but we believe that the increase in our sales since 2016 is primarily going into dairy cattle because of the increasing case trend in dairy cattle. The vaccine itself contains, it's a killed bacterium vaccine, so we take isolates of each of the serotypes of Salmonella Typhimurium, Hindmarsh, Bovis morbificans, and Brandenburg. They're killed and they're put into the vaccine whole. Traditionally, the vaccine gets prescribed in the face of an outbreak on a farm. So when a farm has an outbreak, they'll get in and vaccinate, and then they usually will keep up that vaccination year on year after that because they know that Salmonella is in their herd or flock. In a perfect world, we'd like to prevent that from happening in the first place and get more people preventatively vaccinating so that the farm doesn't have to go through that quite traumatic outbreak situation in that first year. Although sales are on the rise for Salvexin, we still have relatively low penetration. So we estimate about 5 to 10% of the national herd/flock is vaccinated. And unfortunately, generally farmers aren't really aware of the vaccine and that it's an option unless they've had an outbreak, which is what we're trying to change because it's one of the tools for prevention. So it's part of the package, and we're hoping that increasing awareness of the disease, the changing trends in the disease, will help that conversation be had so farmers can make an informed decision about which tools they need to use on their farm. So for the next couple slides, I'll go through some frequently asked questions about the use of the vaccine because it's what, as a technical team, we spend quite a lot of time doing, talking to vets and farmers on the phone about what to expect from the vaccine and how best to use it. So in an outbreak situation, you can expect if you get in and vaccinate a herd of cows or a flock of sheep for that matter, in the face of an outbreak, you could expect new cases to stop about 2 weeks after the first dose. It's a killed vaccine, so really it needs 2 doses for full efficacy. So we're still recommending boostering that vaccine even if cases have stopped boostering at 4 weeks after the first dose. Another question we get asked is if you have a serotype that's not one of the 4 that's in the vaccine, will the vaccine still work? The answer is we don't know because we haven't tested efficacy against the serotypes that aren't in the vaccine. And it probably depends on how similar the proteins on the body and the flagella of the bacteria are to the ones that are in the vaccine. So it might depend from serotype to serotype how much cross-protection you'll get. If you're using the vaccine preventatively in healthy animals, it's worth bearing in mind that it is a gram-negative vaccine, which means that the toxin that's in the cell wall of the bacteria can make animals feel a bit sick for a day or two. So in healthy animals where there's no outbreak going on, you may see a bit of a fever, a bit of a milk drop for a couple of days. If you're vaccinating preventatively in healthy animals, the efficacy that you'll see will depend on how much challenge and what other triggers and stress factors are going on. So if you have a lot of environmental contamination, the animals are really stressed, you may still see a few cases of Salmonella even in a vaccinated herd or flock. So it's not a standalone silver bullet, it's part of the package of tools for prevention and mitigation. We have demonstrated in quite large field studies that the vaccine reduces mortality by 50% for Brandenburg, and this is primarily in sheep that these field studies were done, and 90 to 100% for enteric, which in the case of the vaccine was predominantly Hindmarsh and Typhimurium. How old can animals be when you give the vaccine? There's no label minimum age, so it can be given and is given quite often in quite young animals. We would like at least the first dose to be before the animals are at risk. So we know in calves, they are often at risk within the first few weeks of life, so we have lots of people that give the vaccine to quite young calves. But if you're doing that, we sometimes recommend trying to wait a day or two after they come off the truck to separate the stress event from vaccination, because if an animal's really stressed, it might not respond as well to vaccination. As I mentioned, the vaccine's a gram-negative vaccine. It can cause a bit of a milk drop for a few days. So if you're using it preventatively, then the best time to give it is around late lactation or dry-off, when that slight drop in milk isn't going to impact the farm. And we'd ideally like you to separate it from other vaccines for that reason. So a couple slides ago, I mentioned that we had a farm that we did a trial on to look at whether vaccine-induced antibody passed through the colostrum into calves. And we couldn't we went looking on that farm and found that they had Salmonella already, probably. But the result of that study was that yes, basically by vaccinating the dams at dry off or pre-calving, more antibody got through into the colostrum and then into the calves than if they were born to non-vaccinated dams. So we confirmed that passive transfer of antibodies, and it didn't matter whether the cows were vaccinated at dry off, which was the end of May for an August 10th calving, or whether they were vaccinated in July. So there was no difference between doing them in the middle or towards the end of their dry period versus at dry off. So from a practicalities point of view, for most dairy farms, around dry off would be the best time to preventatively vaccinate. This farm had 30% failure of passive transfer, so 30% of the calves didn't receive enough colostrum within the first day of life, and that's average. That's a normal level of passive transfer on a dairy farm. So there weren't any sort of special colostrum management practices in place that are needed to get this effect. So if you're thinking about whether or not the vaccine should be used preventatively, we can come back to our estimated cost of disease per year on a high or low risk dairy farm to try and help make that decision. So if you think about a low risk dairy farm having an annual cost of disease of between $600 and $700, and a high risk dairy farm having an annual cost of disease between $3,000 and $4,000, the cost of vaccinating a 400 cow herd is about $1,200 a year, and that's quite a high-end estimate because only about half of that is the direct cost of vaccination. The vaccine's very economical for a dairy herd. It is a very cost-effective vaccine. What I've also added to the direct cost of vaccination is the cost of doing all the young stock. So setting the calves up with at least with 2 doses and then beginning to booster the heifers and the cows from there. I've also calculated the cost of that milk drop for a couple of days in your milking herd, and I've included the cost of labor to actually do it all. So it depends on whether you want to consider those extra things or whether you just want to talk about the direct cost of vaccine as to where your threshold is for recommending preventative vaccination. The take home from this is that for herds with risk factors and for risk-averse farmers, preventative vaccination probably makes sense. In addition to the financial considerations of preventative vaccination, there's all the other things that we've already talked about, the non-financial considerations. More widespread preventative vaccination, and this is for any disease really, should hopefully reduce antibiotic use, prevent unnecessary animal suffering, provide peace of mind to the farmer, the consumer, and the milk processor. And in that case, the consumer would be consumer of raw milk primarily. So if the farmer drinks raw milk out of the vat, or there's someone drinking raw milk from the public, that would be the primary risk to a consumer. It will save time and stress over calving because that's when the bulk of outbreaks occur, and reduce zoonotic disease risk, again, from direct occupational exposure or consuming raw milk. And again, as I said, sometimes if the outbreak is putting a lot of salmonella into the milk, you might not be able to supply until the outbreak's resolved, so it helps safeguard your ability to supply milk. So that's really all from me. I guess the take-home points from this are Salmonella is everywhere, and it is endemic in dairy cattle. Although the serotypes are changing, cattle are a reservoir for the disease. We need to be keeping an eye on emerging serotypes and how they're trending, and be mindful of the risk to farm workers, the family of the farmer, people in direct contact with sick animals, or those consuming raw milk. There are a lot of things you can do to try and reduce your risk. The most important thing is managing stressed animals, managing cows over the calving period to try to reduce changes to their gut, essentially, and manage dietary transitions really well, paying particular attention to pelletized magnesium supplementation, and improving hygiene. Preventative vaccination would be warranted if the herd is high risk. It's not going to eliminate disease, but it will reduce morbidity and mortality significantly, reduce shedding, and provide some passive immunity to calves. There's still a lot we don't know, so a lot of this is is speculative in terms of New Zealand's specific situation. So we've had to take information from the international literature and kind of bring it across and assume that those things apply. So there's a lot of research still to be done. And the last thing that I'll mention is that we have a couple of podcasts available on topfarmers.co.nz, which talk about Salmonella in more of a conversational tone with some stories, some case examples, and interviews with affected people. And that's all from me.
Thank you. Thank you, Amanda. That was really interesting, and thanks for giving us such a good overview of all of the risks that farmers and veterinarians need to consider. I guess to wrap it up, I might just start off with just throwing it over to you, Will. I know you're here, you're a veterinarian, you have been a farmer, and obviously you're here advocating for farmers. What's the take-home message that you'd like your members to know about?
Yeah, I guess thanks very much for all the input we've had from you guys today. It's been fantastic. Take-home messages. It's not just cattle, obviously, that are affected. Sheep get it. It can have devastating consequences in a sheep flock. So the hindmarsh, for example, nationwide, can cause significant mortality and morbidity, so that's deaths and infections in your flock around those crunch times, and it's when they're under stress, and usually around some sort of nutritional stress, as we're being told. So it's those sudden changes in diet, or even where maybe the feed isn't up to the quality or the quantity that you'd like for that time of year. So one of those mitigating strategies, as we've talked about it, one of those big tools in the toolbox is to make sure that those animals, they're having their feed managed correctly, no sudden changes, and that they're well fed and otherwise healthy.
So, Will, obviously the conversation today is mostly focused on dairy cows because that's where we've seen a really obvious increase in cases. But for you, coming from the beef and lamb perspective, how do you think about those industries crossing over, and what's the relevance or the crossover messaging?
Sure. So there really is no siloing of those two industries nowadays. We've got dairy cattle grazing on sheep and beef blocks over winter or other times of the year, calves being raised on different properties, etc. So there's an awful lot of crossover there. So really, I guess if there's the opportunity to keep those animals separate, then you can mitigate the spread of not just Salmonella, but many other diseases that occur in these livestock. So yeah, that would be a good one. Probably also worth mentioning, we've heard it before, the fact that Salmonella does affect people. Okay, so people are the most valuable animal on the farm, aren't they? And can you really say that you can afford to spend 2 weeks in hospital if the worst comes to the worst? So keep those people who would be most at risk, anyone who might be immunocompromised, for example, or children or old people. Try and keep them away from any sick animals, and just make sure you wash your hands and keep safe.
Thank you, Will, and thank you for contributing today. It's been fantastic.
My pleasure.
Amanda, I'm going to throw it over to you. Just what's the take-home message, really? There's a number of veterinarians on the call today listening in. What's your take-home message to veterinarians?
So our take-home, the whole reason that we've tried to bring this awareness campaign to vets and farmers is to try to get those prevention conversations happening. So that risk factors are floating around in your mind. You're constantly thinking about, okay, what is my risk profile? Is it worth me proactively doing something to try to prevent or manage salmonellosis? And just as Will mentioned, a lot of the things that you would do will also help with other infectious diseases. So it's never a bad idea to have good hygiene. It's never a bad idea to think about asking some questions about herd history, or maybe checking in with your neighbors about what's been going on in their place. One thing we haven't mentioned is if you do have an outbreak, it is a good idea to tell your neighbors. I know it can be a little bit embarrassing if there's an animal health problem on your farm, but you're potentially, you could be saving them a big headache if they can get in and maybe preventatively vaccinate their stock, or try and put up some more boundary measures. Maybe if they need to walk stock down the road, they might take them a different route or something like that. So it's quite a considerate thing to let your close contacts or neighbors know if you're having a problem, let your milk processor know, and proactively having those veterinarian farmer conversations around what's your strategy if you start to see cases, or what do we need to do to try and prevent cases in the first place? Are there some things we can put in place? Maybe preventative vaccination if it's warranted, maybe some improved biosecurity measures, maybe some improved hygiene measures.
Thank you. Thank you, Amanda.
Yeah, thank you, Pauline.
That's great. So thank you everyone for joining with us today, and I hope you found this format informative. I've certainly learnt quite a lot today, and I really want to thank both Will, Lisa and Amanda for their input today. I think in summary, we're talking about animal welfare, we're talking about significant risk to farmers' income, to their production, probably their mental well-being, considering how severe some of these outbreaks can be. And I think also the public health risk here is significant. So I hope what we've shared with you today can help form some great discussions with both veterinarians to farmers and farmers about this disease. Thank you.